Welcome to the Newby Health Perspective with Dr. Newby. This is your go-to source for all things health and wellness with your host, Dr. Newby.
Good afternoon and welcome to the Newby Health Perspective, your go-to source for all things with health and wellness. I'm your host, Dr. Keith Newby, president of the James E. Newby Jr. MD Foundation, cardiologist and market director for community health improvement and engagement with Bon Secours. And every week I'll be here to guide you through the latest in the medical world, both past and present, ideas to consider, health tips and perspectives, and expert advice. I know last week I told you I was going to talk about part 2 of the winter preparedness, just to get you guys ready for the winter season, things you needed to be aware of. But I wanted to take a moment to put that off to next week. I want to talk to you a little bit today about medical news, things that happened in 2024, just so you're aware, more of an end of the year, beginning of the new year type scenario. But I also wanted to talk to you about something equally, if not more important. Anytime we visit a healthcare professional, we are most often concerned about staying healthy or getting better from the condition that plagues us at the time. As part of that process, many of us spend a lot of time asking friends or family for referrals, visiting websites, reading reviews, and making sure we are comfortable with the professional and their office staff. After all, who doesn't want a good doctor? We expect a lot from our doctors, but it's a two-way street. I'm thinking about what it takes for your healthcare provider to meet your expectations. It is just as important to think about what it takes to be a good patient. Being a good patient means more than just sticking out your tongue and saying, ah. As a patient, you should have an active interest in your care and treatment. We love our patients that we see and kindly request that you ask yourself this question: how can I be the best patient for my doctor? And here are some tips I want to share with you. Number 1, share your history. Healthcare histories can sometimes be complicated. While no one would expect a patient to understand each and every detail, keeping careful records of your medical health, procedures, medications, whatever, can be helpful in creating treatment plans. Now, a lot of times I will run into patients who would say, what's in the record? I'm like, but you don't know what's in the record. And half the time we don't know what's in the record. There's no uniform health record system, be it medical records, be it electronic health records, whatever. There's no unified system out here. We have to depend on getting accurate information from you as a patient. Looking at me and saying, well, it's in there. Look in the record. That's not helping me help you. And that's not helping having any doctor help you. You have to be diligent with understanding your medical condition, because there may be some things in the record that are wrong. And if you don't know and you don't pay attention to what's going on, you could be labeled with something you don't really have. I'll give you a prime example. Had a patient several years ago who had in his chart he was HIV positive. And, the guy was like probably 78 years old. And that's not to say at 78 years old you can't have HIV. But when I queried him about it, he was like, I don't have HIV. And I said, well, your record says you do. And he was like, where? So I showed him, and it was something that was put in one of the local hospital systems of unclear reason. Anyway, he was actually HIV negative and has been tested as such in the past, but for some reason it was noted as being positive in his record. So the guy had to go through, I think, 2 or 3 years trying to get that expunged from his record because it wasn't true. And he was wondering why he had got turned down on an insurance policy, and they didn't say why, but that was the reason why. And it was actually not a real diagnosis that he had. So I would emphasize making sure you are aware of your medical history, but share it. Don't hide it. Stay on top of it so that you know and we know what's accurate and what's not. Second thing, be on time and courteous. This one seems like an easy one. While healthcare providers are infamous for running behind, and I've been one of those at times, but it's not that I'm sitting around playing golf all day. A lot of times I had an emergency at the hospital, which held me up, or it may be that I had a patient show up late, and it's a domino effect. A lot of patients feel like, oh, you're 2 minutes late, and my appointment was at 9 o'clock, and you're here at 9:03 or 9:02, and I have a problem with that. Now, granted, that's a little over the top. I've not actually had anybody do that, but I have had people who make comments, and I always am very apologetic when I come into the room with a patient running behind, and it's not that that's an intentional thing. That's the reality of what we have. But what happens is when you're late, then it's a domino effect to people behind you. And that oftentimes will trigger an issue where then you start running behind, period. And that one time that you're late can be a domino effect to other patients. So I want you to be on time and courteous, not just for you, but for others around you. So in the spirit of togetherness, a lot of times I will still try to see you even though you're late, and it creates a domino effect because, I care about people who are sick regardless of whether they're tardy or not, but the traffic jam in the waiting room then occurs. Doctors and staff are here to help and should be treated in the same level of respect that you would want to give others. So again, just be mindful if you're late. That could be a domino effect, and don't be upset if you are a victim of the domino effect, because again, we're not here to try to make you wait. We're here to try to help. Now, the next one, know your rights. The patient-provider relationship is a privileged one and is definitely a two-way street. Knowing your rights means taking the time and feeling free to ask questions about any aspect of your care, including obtaining and sharing a second opinion. So I tell people all the time, I welcome anybody that wants a second opinion behind me because I don't want you thinking that I'm not doing the best I can for you. So I encourage that if that's something that you seek. The majority of the time, I feel very comfortable with any medical condition that I have to come up against. But there are times I may seek another opinion. I may ask them and say, listen, I want to send you to this other doc. He's a little bit more expert than I in this particular arena. I want to make sure you're getting the very best that I can give you. So there are times where I will make that recommendation for a second opinion, but just be upfront yourself. If you plan to do that, tell your doctor. I'd rather you be upfront than to find out after the fact that you went somewhere else. It's just being courteous, especially if a medication or a treatment plan was altered and we are thinking as physicians that you're taking one medication and find out somebody changed it because you went for another opinion. I mean, to me, that's your right to do so. So don't be ashamed of it. Stand up and say, okay, I wanted to seek another opinion. That's no disrespect to you. It's something I felt important to do, and I think we should all honor that. But just be upfront about it. Next, be knowledgeable about your insurance. Paying for healthcare can be quite confusing and is a maze with foreign and technical jargon. It's even more complicated now than ever. While your doctor's office can assist you with understanding complexities and nuances of insurance billing guidelines, it is important to start by taking the time to understand your policy in order to avoid unpleasant surprises. A lot of times, somebody will say, well, I never had to pay a copay before. And that may be true, but your insurance may have changed in terms of how they handle things and you might not be aware. It's not always the doctor's fault. A lot of times, I'm going to tell you, insurance companies like to play games. And sometimes they'll deny things. They'll say they're going to pay for it, then deny it. And you as a consumer need to be on top of your insurance carrier. If they start tripping, you need to get on them. And don't beat up the doctor's office. Beat up your insurance carrier. They're the ones that probably the vast majority of the time are the ones that's making errors. It's not, well, I shouldn't say errors. They do this stuff sometimes intentionally to create an issue for you, but you should be aware of what you're entitled to with that plan, and if there are changes that occur, you need to be aware of it. Now, follow-up, which is the next thing. Part of being a good patient is following the course of treatment agreed upon by you and your provider. While this follow-up might be inconvenient or difficult, following the advice and recommendations of your doctor has been shown to improve clinical outcomes, the very reason for your visit. A lot of times I'll have patients that will get the medicine and expect you to continue to renew it every 5 seconds when I'm like, you haven't even come in for your follow-up. I don't know that it's doing what we needed to do. And I guarantee you there are a lot of patients who will say they're fine with taking the medication. Some are fine, some are not. But the bottom line is, if you are agreeing to a treatment plan and you don't follow up, how will we know that the treatment is working? And we can't sit there and track you down. I mean, we're all very busy. I mean, I probably work somewhere between 12 to 16 hours a day, and that's almost every day. So I don't have time to track you down, and most doctors won't. That's got nothing to do with being mean or anything else. It's just the facts of life. I don't have time to track you down and make sure you're doing what you're supposed to do. And unfortunately, so sometimes patients will do some things not always above board. So honesty is key as well. If you agree to take a medicine and you say you're taking it and you're not taking it, and when I say take it, I mean take it as prescribed. Read the bottle and follow what the bottle says. Got a patient not too long ago who was taking a pill once a day, but it was a twice-a-day pill. And he told me, and he was just a straight up, I'm taking it every day, doc. But I'm seeing all these extra pills in his bottle. And that's the next thing I want to get to is making sure you bring your medicines with you. But this particular patient was taking it once a day and was proud of it. And I looked at him and I said, dude, what does the bottle say? And he says, I don't know, I never read it. I said, well, maybe it's time for you to read it. It's twice a day for a reason. Many of these medications have a certain half-life, which means the amount of time it takes for half the drug to get out of your system. So if the drug only has like an 8 or 9 hour half-life and you're taking it once a day, that means by hour 12, the majority of it's out your system. So it's dosed the way it is for a reason. And you have to follow what the bottle says, because you can't hold the doctor accountable that you're not getting better when you're not following the treatment plan. If it's a weight issue and he's telling you he needs you to lose weight and you don't lose the weight, and I know losing weight's tough, and I'm not getting on anybody about that part. But what I'm getting you on about is if you're not trying, or you try and you try to be dishonest about it, that's not helping. So honesty is going to be key, and that's one of the next things you have to be is honest about your health care. Don't say or don't try to tell the doctor that weight or some other aspect like you're smoking or whatever other habits you have don't have anything to do with your medical condition. A, you don't know that. B, you're not astute enough in healthcare to always know the answers to those types of questions and comments that are being made. So you don't have the background or the understanding of medical knowledge or anatomy and physiology to make those judgments. And, a lot of times, when it's you as the patient, even if you did know something, it's always better to let somebody else handle your care because, again, you don't want to be a fool for a patient. And that's what I say, when you try to be your own doctor, it's like having a fool as a patient. You don't know, and you'll oftentimes blow things off and not really pay attention to things because you're going to justify it, and you don't want to do that. You want to be upfront and know that what you're talking about is based on understanding of medical conditions, and let the other person who is your provider take the lead role. And I'm not saying don't ask questions. You can always ask questions, and you should ask questions. That's how you know what's being done is correct. We're not perfect, so I'm not saying that, but we know more than you do. As far as health is concerned, that's like you come to me asking me about a financial question. I'm not a finance person. I expect those who are expert in that went to school for that and understand finance better to be the ones that's guiding you and guiding me. And I'm not going to sit there and tell you how to invest your money. That's not my area of expertise. Medicine is, and let us do our job. One of the last things I do want to talk about is medication refills and the dreaded forms. Now, many of us as physicians, as it relates to forms, I understand and we understand as medical professionals that there are many forms that have to be filled out. And we do understand that. But most of us did not go into medicine to fill out forms. What we did, we went into medicine to try to help people feel better and to help save lives. And that's what we do. And we try to be the best at it. But filling out forms is not my idea of a dream come true. Half the times the forms that you guys give us are confusing, and it takes a lot of time to do that stuff. And sometimes people would drop off a form thinking we ain't doing nothing better but waiting there to fill out your form. And it's not to say that we don't honor that and respect that, but that's not the highest on most of our priority list. I know it's definitely high on my priority list, and that has nothing to do with me being hardcore or anything like that, but that's the reality of what we have. When you work 12 to 16 hours a day, and at the end of the day, you think I'm going to stop to fill out a form, the likelihood is not that great on that one. And again, I hear you. I understand where you're coming from, but this is what I kind of feel. As an example, let's talk about FMLA paperwork. Now, for those who know what that is, those forms allow you to go see doctors and all that stuff. Now, a lot of employers will have us fill the same form out every year. Now, again, we could always keep a copy of your form and try to copy and paste it over or whatever, but that still takes time. And to me, I should be able to shoot a quick letter out to say, same FMLA conditions apply to this patient, such and such, date of birth, such and such. Please honor that same form. Instead of having to fill the same form out every year like we got nothing else to do. And again, most of us have no problems with making sure you get what you need. It's the process that's the issue. I give you another prime example. Somebody that may need a letter talking about a certain condition that they need special consideration at their workplace or at school. Well, we have no problems doing it, but if I have like a note that I did from the office and I specify the specific requirements in that note, why do I have to do another letter saying the same thing? Why can't I just give the note to that particular job and say, okay, the conditions are in this note and we're done? But no, you have to fill out a separate form saying specifics, even though the specifics are in that letter, but it's not the format that they want. Now, my thing is, as the patient, I'm looking for you to protect us as well, meaning, why don't you go back to the job and say, listen, the doc gave you the form. Why we have to do something different? It's sitting there black and white for you to see. You just want it on your form, and that's not the way this should work. I want you to protect us as much as you're asking us to protect you. Because again, we're not sitting around all day just waiting to do paperwork. So, again, I'm just asking for the respect that is due to understand that that's not going to be the highest on our priority list. But I also would like for you to go back to your job or employer or whomever and to say, listen, Doc already wrote this out last year. Why does he have to write the same thing out in the same form every year if it's the same information? Now, if something's changed, that's different. But I'm talking about in the setting of the same information, we shouldn't have to sit there and fill out another form saying the exact same thing. Again, time. And so that's the big thing. Let's talk about prescription refills. Don't wait till you're on your last pill and call in and then expect we're going to drop what we're doing right then because you decided to wait. Nobody's keeping track of your refills. All we're asking you to do is when you go get that last refill from the pharmacy, that means you either have 30 or 90 days to get that request back in from the time you pick that script up. That's when you should be calling your doctor's office and say, I need a refill, sit in, because we may not get to it right immediately because, again, we're working 12 to 16 hours a day. So when we have time to get it done, which may take a few days to get to it because we have a bunch of other people having similar requests as well. It's not just you as an individual person. So I'm just asking for consideration as to our time. Don't wait till the last pill and then call in and get upset because nobody's dropping what they're doing to do it right then. That's not going to happen when you have people trying to save lives. I'm not going to stop trying to save a life. Somebody's having a cardiac arrest in the emergency room. I say, okay, I got to stop what I'm doing because I had to go do this patient's refill. We're not going to do that. We're going to hit the people that are the sickest, and then things go downhill from there. So it's not that we don't want to do it. It just would be helpful if you would work with us. And when you hit that last refill, when you pick it up from the pharmacy, that's the time to reach out to us. That gives us between 30, depending on how many pills you have, between 30 and 90 days, because most prescriptions are either going to be 30 days or 90 days. So that gives us enough time to make sure we send it off timely so that you get what you need. So again, it's just about being courteous, that's all. So now let's talk about the medical news world of 2024. So I'm going to start in January with an article talking about could researchers develop a vaccine to lower bad cholesterol. So all people need some cholesterol, but having too high cholesterol levels can be dangerous, particularly to areas of cardiovascular health. Research is ongoing to find new ways to help people keep cholesterol within a healthy range. Data from a recent study on animals found the vaccine may be effective at lowering cholesterol levels, but future research is required before this data can be applied in clinical practice with humans. So there is a possibility that it could be a vaccine developed that will help keep your bad cholesterol low and reduce your cardiovascular risk. So I look forward to hearing what may happen with that, but that was what occurred in January of this year, and I thought this was just an important piece of news that I wanted to share with you. So in February of 2024, there was an article that came out discussing fasting-like diets may help reverse biological aging by 2.5 years. A study showed a fasting mimicking diet, or FMD, lowered insulin resistance, liver fat, inflammation, and other markers associated with aging. The diet is based on the consumption of formulated food with controlled levels of dietary macros on days 1 through 5, and then eating normally for 25 days out of a month. This fasting-like diet style is not suitable for everyone, including pregnant people and older adults. So these 3 cycles of so-called fasting mimicking diet were shown to reduce those biomarkers associated with insulin resistance, liver fat in humans, and other markers associated with aging, as I mentioned before. This study came out of University of Southern California. This person, Walter Longo, who is a senior author of this new study, developed this diet. So this diet is high in unsaturated fats and low in protein, carbohydrates, and calories. The study examined the diet's impact in 2 clinical studies, including men and women between the ages of 18 and 70. Participants who followed the fasting mimicking diet went through 3 to 4 monthly cycles following the FMD for 5 days and adhering to a normal diet for the other 25 days. Results showed that patients in the FMD group had less insulin resistance, lower hemoglobin A1C results, and better fasting glucose results. They also had less abdominal fat and liver fat, along with improved immune system markers suggesting lower inflammation. So this is something I want to bring up as what happened in February. I'll be able to review some of this information and see if this is something that you would like to investigate further. So for March of 2024, an interesting article came out about happiness can be learned, but it takes 7 practicing habits. So tools for promoting one's sense of well-being can deliver a long-lasting benefit if one continues to use them. Years after learning about such quote-unquote science hacks at the University of Bristol, roughly half of the students continued to feel happier. The school's Science of Happiness course helps students to see problems in a less self-centered context that tends to make difficulties seem less monumental and worrying. So I know we are living currently in a very self-centered society, and people are all worried about themselves and not anybody else. Well, part of this tries to teach you how to look at things from a different perspective. So Dr. Bruce Hood, the senior author of this study and author of, quote, The Science of Happiness, 7 Lessons for Living Well, end quote, listed what he called happiness hacks taught in the Science of Happiness schoolwork. One is performing acts of kindness. Another is increasing social connections, including initiating conversations with people you don't know, savoring one's experiences, deliberately drawing our attention to the positive events and aspects of one's day, practicing feeling grateful, and endeavoring to thank people they have never sufficiently thanked as they would have liked to previously, being physically active, exploring mindfulness and other meditation techniques. Personally, as a Christian, I'm into prayer and trying to follow God's word. If you look in the Bible, I don't remember Jesus ever saying it's all about me. He came to earth to serve, not to be served. So when you look at things from a standpoint of doing for others, I think that may help. So some of this goes along with that. So I encourage people to get back into church, because that's not a bad thing to do. I'm in there most Sundays. Sometimes if I'm on call, it's hard to get there when I'm on call, but I try to make sure if I can't get there, I read my Bible, I do studying, meditation. My wife and I a lot of times will pray together because that brings families together. Especially if you're equally yoked, you'd be surprised what that could do to help keep you happy. So again, whatever it is you need, and I'm not saying it has to be a Christian-based scenario. It could be any base scenario that works for you. That's just something I believe in. And I tell you, it has really changed my life, has had me doing things for the better. So in April, I found an interesting article that I thought you might like to hear. Well, you may or may not like to hear this. I'll let you be the judge. So it says exercising between 6 p.m. and midnight may be more beneficial for people with obesity. So obesity increases a person's risk for several medical conditions, including type 2 diabetes, cardiovascular disease, and certain types of cancer. Scientists have been trying to determine what time of day is best to aid weight loss in people with obesity. So researchers at the University of Sydney in Australia have found that getting the majority of daily physical activity during the evening hours offers the most health benefits for people who have obesity. So this new study came from the researchers at the University of Sydney in Australia, as I previously mentioned, published in the journal Diabetes Care, suggesting that getting the majority of physical activity during those evening hours offer the most benefits, especially in those with obesity. So why is this important? Well, there are over 1 billion people in the world who are considered obese, with projections that this number could potentially hit 4 billion by 2050. So in Australia, about 2 in 3 Australians have excess weight or are obese, which is a significant risk factor for many chronic illnesses, such as I mentioned before, diabetes, cardiovascular disease, and certain types of cancer. So one of the key drivers of obesity-related complications is insulin resistance, a condition which eventually leads to high blood glucose levels and type 2 diabetes. Having high blood glucose levels can cause catastrophic damage to our cardiovascular system and lead to organ failure. So exercising after 6 p.m. was linked to the lowest risk of death during this study. And that could be brisk walking, dancing, mowing the lawn, lifting weights, swimming, whatever you like to do, but I would recommend that you look at some type of physical activity such as jogging or running, hiking, shoveling, aerobics, or playing soccer or basketball, whatever you enjoy doing. But pushing a remote control button with your thumb ain't considered exercise. So I want to make sure I'm clear about that. But I thought that was interesting. And again, if you really think about it, it makes sense. If you exercise in the evening, you're reducing your blood sugar just because of the working out you're doing, and that's going to cause you to burn more calories and burn more glucose levels down through production of insulin. So that can help with that nighttime when you're going to bed because you're not doing anything when you're asleep. A lot of people's blood sugars may rise during the night, but this would help actually keep those blood glucose levels down. So it makes sense when you really think about it, and I think this is beneficial to make sure we keep you at your healthiest. So for May of 2024, this article I thought you might find interesting is new research helps explain why people move slower as they get older. So as human beings get older, our movements naturally start to slow down. New research suggests that older adults may move slower partly because it costs them more energy than younger adults. Scientists believe these findings could lead to new diagnostic tools for diseases such as Parkinson's and multiple sclerosis. So some potential explanations, of course, is slower metabolism, loss of muscle mass, and becoming less active over time. And some of us are just like is old Arthur coming back to bite us. And that is true, and we will degenerate as our bodies get older. But it could be helpful if we find there's some link that we could figure out how to conserve energy that may slow down some of the aging process and help us live a little healthier lifestyle when we get older and not hurt as much. I've found as I've approached slightly older age, things hurt a little bit more when I get out of bed, and that hurting can slow you down a bit. So it's not just this information, but I thought it was intriguing as to where this could go. So again, everything about research is developing new ideas, new strategies. How do we live better lives? And if we can do that, hey, God bless us. Let's make it happen. So in July of 2024, an article came out entitled New Drug Helps Fight Typical Signs of Aging, Extends Lifespan by 25% in Mice. So scientists have discovered that deactivating a protein called IL-11 can extend the healthy lifespan of mice by nearly 25%, raising the potential for similar benefits in humans. Researchers found that removing the IL-11 gene or using an anti-IL-11 antibody dramatically increased the lifespan and health of aging mice. These findings suggest that anti-IL-11 treatments could combat age-related diseases with minimal side effects, offering a promising avenue for future human trials. Now, again, I don't want to get into the aspects of prolonging life as it relates to any religious beliefs. This is just me reporting news that I found that I thought would be interesting. So again, if you can live longer but have less diseases, hey, listen, God bless us. I'm glad that and I hope we're able to achieve that. But I found this interesting, and we'll just see what happens. Again, whether or not this will be able to be applied to humans is unclear yet, but I thought it was interesting to see that if, in fact, this can occur, and, in fact, if it reduces the incidence of other medical conditions that otherwise would take us away from here or make our lives more miserable as we got older, that might be a good thing. So let's just see what happens with human studies. So, again, I know we're getting close to the end, and I wanted to get through the rest of the year's news. And what I'll do next week is I'll finish up my winter preparedness talk, and I will finish the August through December news. So again, I wanted to bring up the first part, which I thought was important, which is how to be a good patient. I know we as doctors are held to higher standards, and I think patients should be held to some standards as well to help us doctors deliver the best care to you. And then we talked about some of the medical news in January through July, and I'll finish August through December next week. So again, this is Dr. Keith Newby. I enjoyed always being here with you. I hope you get something out of these broadcasts that I'm doing. The platform is great to try to help us live longer and live better. Visit our website at www.newbyfoundation.org. Please blog any questions you might have, and I'll be more than happy to try to answer them on the air. And I thank you again for your attentiveness and listening today. And listen, God bless, take care, stay healthy.